Good morning. Today is Saturday, March 30th, 2024. This is our regular yoga therapy class. So let's do a little sound check, 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 sound check. And okay, here we go. Check again, sound check. 1, 2, 3.
Check again, sound check.
Yeah, all set. Okay, as I said, we are doing all the requests, and let's see what happened to my, okay, here it is. So today's request is polycystic ovarian syndrome, PCOS. So what is the interest in PCOS? And again, we have not done a polycystic ovarian syndrome. And let me go over with you again what is called a pathophysiology, pathology and physiology behind it, and how yoga therapy can help in PCOS. A lot of young women today is suffering from PCOS, polycystic ovarian syndrome, and interestingly, it is a part of our metabolic syndrome. What is a metabolic syndrome? Metabolic syndrome is the outcome of our stressful lifestyle. And it acts through a pathway which is called the limbic system, called emotional brain, two nuclei, amygdala and hippocampus. Amygdala responds to fear, hippocampus responds to memory. Through neurotransmitter, it sends a signal to your hypothalamus for homeostasis. Hypothalamus then sends a signal to your autonomic nervous system to have a high sympathetic drive, and also through pituitary adrenal axis with a high cortisol. So the outcome of your stress in your body, which responds, is a high sympathetic tone and effect of cortisol. Cortisol converts sugar into called a omental fat. We call it truncal obesity. This expanding waistline, spare tire. We have a lot of names for it, but this is the truncal obesity is the beginning for the metabolic syndrome and beginning of polycystic ovarian syndrome also. This is called actually a phenomena called a thriftogen hypothesis. Thriftogen hypothesis means body feels there will be no food tomorrow. So it's storing the food, and this fat is inside your abdomen. The omental fat then secretes adiponectin, pro-inflammatory molecule, and creates a cascade of phenomena of which we get diabetes, hypertension, coronary artery disease, high cholesterol, or called dyslipidemia, high triglyceride and low HDL, and also polycystic ovarian syndrome. And actually, this is also starts, the stress and fear also comes from sleep apnea, insomnia. So sleep apnea also a part of this metabolic syndrome, because all of you know that sleep apnea could cause your diabetes, hypertension, truncal obesity, and you name it. So the women who has a polycystic ovarian syndrome, a stressful life, it really first starts with a irregular menstruation. A menstrual period is irregular. Then the PCOS, the disease itself, and from our Western medical standpoint, is a syndrome called insulin resistance. Insulin resistant syndrome basically is the basis of your metabolic syndrome. In insulin resistant syndrome in women also causes a hormonal imbalance. So if you know the most of the symptoms of disease from the women which does not has an organic cause, it's a functional autonomic dysfunction or functional hormonal imbalances, which includes first, say, premenstrual syndrome, PMS, premenstrual syndrome, PMS. PMS is also a hormonal imbalance. Women with, say, menopause or menopausal hot flashes, perimenopause, all are either a hormonal imbalance or autonomic dysfunction. Sudden hot, sudden cold, autonomic dysfunction, hormonal imbalance. So in PCOS, polycystic ovarian syndrome, what you have a high male hormone, which is called androgen. So the women with PCOS will develop a sign of androgen, like a male hormone pattern. What male hormone pattern is called hirsutism. Hirsutism means hair. They will have a facial hair. They may have a hair in your, like a mustache area. They'll have a hair in your chest. That's called hirsutism. Male pattern. Male pattern baldness, like what we have. We have a frontal baldness. This is called a male pattern baldness from androgen. And women will also have a front, the frontal baldness. So if you look at the ovaries are enlarged. Ovaries are bigger, and ovaries had they call it polycystic. There are multiple cysts. Cysts are your fluid-filled small cavities, and in ovary they carry your immature eggs. You can say immature egg cells, or you call it a follicle, and most of them do not cause any pregnancies. So eventually also person with PCOS develop infertility. But remember, underlying cause is in the limbic system with a high sympathetic tone, high cortisol level. So as all of you know, a practice of yoga therapy causes relaxation response, activation of parasympathetic tone, and it is basically a antidote to your PCOS, which is a component of our metabolic syndrome. So as all of you know, that yogic tradition is a massage to the organ, improves the function of the organ. So the first we have to go back to the cause. The cause is to quiet down the limbic system, which is called a manasthir. Manasthir means your stillness of your mind. And manasthir mind comes from the yogic tradition, the content of your five senses. We hear, we see, we smell, we taste and touch. So controlling the five senses, which is the fifth limb of yoga, is called pratyahara. Pratyahara means reject, ahara means your input. Input is not only eating, input is all the five senses, what we hear, what we see, what we smell, taste and touch. So controlling meditation is the number one. And remember, we do not do the meditation. What we do, we prepare our body and breath to enter into a state of meditation. Preparing your body, the asana which we prepare is called a sthiram sukham asana. Stillness, happiness in a asana pose. And most of the stillness and happiness comes when you keep your spine straight. This is called Merudanda Achal. Like I'm sitting here, I'm sitting on your kneeling stool, and all of you have seen what kneeling stool looks like. Like if you sit in a kneeling stool, you can always keep your back straight. Here it is, your kneeling stool, and you sit down like this. And for me, I've been doing it for a long time. When you sit down, I have a motorized table, so I keep my table here. I'm looking at my computer screen. Because you cannot get out of this, so you have to have a computer screen and you have to have the level, the eye level. So Merudanda Achal, that means keeping your spine straight, and Manasthit, quiet down your mind. Quieting down your mind is a very quick a meditation practice, which we'll do at the beginning. Then you have called a Bhramri Pranayam, bumblebee breathing. Then you have your chanting, Om Pranayam, or we call it Udgit Pranayam, and also called your Pranabhu Pranayam. Pranabhu Pranayam, A, U, Ma, and also do with the mudras. This is a very, very powerful mudra, Dhyana Mudra, Jnana Mudra, also Vayu Mudra, quiets down your Vata energy. In a regular yoga practice, asana is practiced before pranayama. Give 8 steps: yam, social restraint; niyam, personal restraint; asana, external and internal alignment; pranayama, voluntary control of your breathing; pratyahara, control of your 5 senses; dharan, focus; dhyan, meditation; samadhi, union of your body, mind, and spirit. But yoga therapy, we do adaptation of the yoga practice. We use the same tool, same Yoga Sutra of Patanjali, same your 8 limbs of yoga. Excuse me. But we do adaptation, pick and choose. So we'll show you all the practices, like for your asana practice. Asana practice, primarily we target the asanas which is geared at massaging the abdomen. But number one massage is all you should know is your Kapalbhati Pranayama. Actually, Kapalbhati Pranayama is called Agni Pradhan Pranayama, and it is also called a metabolic pranayama. That means it really is a yoga practice, yoga therapy practice for your metabolic syndrome. And then the asanas, like say, we'll show you the asanas. The seated forward bend, Paschimuttanasana. Then you call it grinding, Chakki Chalanasana. Then they can do from there, say Vakrasana, spinal twist. Ardha Matsyendrayanasana, half, we call it a Ardha Matsyendrayanasana, half, what do you call it? There is no English translation. Lord of the fish pose, or whatever. Okay, we'll show it to you. Then let's say a seated twist, even doing a seated spinal twist causes massage in the abdomen. So let's start first. You're quieting down your 5 senses. I'm sitting with my spine straight. Then I first start with the hand mudra. This is called Dhyana Mudra or Jnana Mudra, touching the index finger and thumb, and put it over my knees, and I close my eyes. Hand is a connector between your body and mind. Out of the five senses, your vision is the most active sense. Eye is the outer extension of our brain. Eye is supplied by 5 cranial nerves. Retina in the back supplied by the optic nerve, which goes straight into your brain. 2 muscles in the eye supplied by an individual cranial nerve. SO4, called superior oblique muscle, supplied by 4th cranial nerve. LR6, lateral rectus, supplied by 6th cranial nerve. Trigeminal nerve also supplies the eye, so as a branch of facial nerves. Able to close the eyes, keeping your spine straight, having your hand mudras, quiets down your mind. You're in silence. Then you follow your breath. Visualize your breath. Breath centered, quieting down your mind, or breath centered meditation practice. Visualize air is coming from outside through your nostril. Our nose is our filter. It filters all the air is coming in. Nose is like our personal air conditioner. Outside air is warm, it will cool down, and outside air is cool, it warms up. Nose has the blood vessels, very high concentration of blood vessels. It actually almost like your corpus cavernosa. So by regulating the blood coming into your nostril, it acts like an air conditioner. More blood comes in, it's warm. When the blood vessel gets constricted, it gets cold. You'll see when you go little outside in the cold, since it is cold, all the blood vessel comes in, they all try to keep you warm, and you start having a little runny nose. The fluid is coming out because you have an extreme blood supply to your nostril. These are the explanations most of the yoga teacher needs to know. That's what I've been explaining to you. You will be doing it with eyes closed, but I'm talking and give you explanation. The air now, which is in a proper temperature, goes to the side of the nostril where there is some channel called a turbinate. In a turbinate, it generates a vortex. The vortex of the air goes over your mucous membrane of your sinuses. Mucous membrane of your sinuses releases a substance called a nitric oxide. Nitric oxide is a potent vasodilator. It opens up the blood vessel and it also helps in endothelial function. It is also activator of a parasympathetic tone. So nasal breathing, a lot of study has shown, reduces your blood pressure because it causes reduction in the peripheral resistance called vasodilatation. Air is going behind your throat, upper part of the lung, middle part of the lung, lower part of the lung, almost at the level of your belly button. At the level of belly button, the breathing stops for a short time, which you call a Keval Kumbhak. Then visualize your air coming in from the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming out through your nostril, outside the nose, breathing picks up and subtle energy called prana. Prana is not a breath. Prana is like an electricity, and breath is like electric cable. Breath is carrier. Prana helps us to be awake, alert, and alive. So breath is taking the prana. In yogic tradition, our whole body does the breathing. So it is taking your breath to the organ of healing. Heart disease, I'm visualizing the prana is coming to my heart, do the healing. If you have a back pain, you can visualize it is coming through your back, healing your back. Pranic healing technique. Just a short time, I'm developing a parasympathetic activation, and I'm developing a reduction of my sensation. The two fingers here, the index finger and thumb, I feel the sensation has gone down, and I also started feeling the capillary pulsation. When you feel a capillary pulsation, feel the numbness in the finger, that means your limbic system is quieting down. Since it activates parasympathetic tone, see, I'm having a saliva in my mouth. Your wet mouth, I'm talking, I'm not drinking any water, my mouth is wet. So saliva in your mouth shows a sign that my salivary glands, submandibular gland, parotid gland, they're getting all supplied by parasympathetic nerve. I'm having some wet mouth. So they're fearful. At the state of fear, you develop your dry mouth. Dry mouth is a sympathetic tone. So breath-centered meditation quiets down your limbic system. Quick controlling of your five senses. Same posture, spine straight. Jnana mudra, dhyana mudra, meditation mudra. This is also called a meditation mudra. Put one and touch your thumb. This is also meditation mudra. You'll see your Buddha sitting in this, but this is a powerful mudra, meditation mudra. With your eyes closed, visualize 5 objects around you. Pick up 4 objects out of 5. Listen to the sound of these 4 objects. Every living, non-living substance in this world has a sound. Nada yoga. Nada yoga. Yoga of sound. Visualize 3 objects and smell the 3 objects. Try to see if you can distinguish between the smell of these three objects. Visualize two objects. See if you can sense the taste of these two objects. Visualize one object and touch that object. Stay in that posture. My mind is quieting down. I can feel my body is relaxed. My breathing is getting effortless. Breathing is very calm and quiet. Controlling your five senses. Our brain or our whole body has a frequency of vibration. These vibrations are recorded in, like when you do a tracing, like electroencephalogram, EEG, or electrocardiogram, EKG. When you create another vibration, the two vibration cancels, called harmonic resonance. And that is your Bhramri Pranayam, bumblebee breathing. We shut down all the five senses. We create a vibration, bumblebee breathing. And so keep your index finger, put it on your forehead. You can use the Shanmukhi Mudra or use your three fingers to close your eyes. Use two fingers to close your ear and close your mouth. You'll be breathing out first, then you'll breathe in through your nostril, breathe out with the sound of a bumblebee, and that will be followed by your palming and cupping. Breathe out first. Take a deep breath in. Followed by palming and cupping. Rub your hands, rub your hands. And you feel the warmth of your hands. If you're wearing glasses, remove your glasses. Take both the hands, put it over your eyes. Let the eyes take all the heat from your hand. The heat relaxes your eyes, relaxes the ciliary muscles. The lens became more convex. Almost acts like reading glasses. You don't need the glasses. Relaxing your eyes relaxes your brain, because the eye is an extension of your brain. Massage your forehead. Relaxes the muscle. All the muscles are attached to your skin. By relaxing the muscles, all the line goes away, all the frowning goes away. Take your hand, massage your face. All the wrinkle goes away because your tension goes away. Take the hands behind your ear, massage the earlobe, massage the ear in front. There is called your auricular branch of the vagus nerve, and it activates your vagal tone. Vagal tone is activation of your parasympathetic tone. Take your hand, massage your carotid sinuses, Massaging carotid sinuses quiets down your cardiovascular system and nervous system. Take the hand to the back, massage your occipital tubercle, sternomastoid muscle and trapezius muscles are attached. Those are supplied by cranial nerve. Om pranayam and pranabho pranayam. Om pranayam is a continuous sound of Om when you do it, and pranabho pranayam is your A, U, and Ma. A comes from the lower part of the lung. U comes from the middle part of the lung. Ma comes from the upper part of the lung. When you touch your index finger and thumb and put your palm down, this is called your chin mudra. This opens the lower part of the lung. So you do A with the chin mudra. When you close your hands, this is called your chinmay mudra. It opens the middle part of the lung. We do U with this. And Ma we do with the Adhi mudra or called Balo Mushti mudra, like it's a baby fist. Pranabho pranayam. Chin mudra, breathe out first. Chinmay mudra. Ooh, ooh. Mum. It's going to quiet down your mind. Massaging the abdomen with a Kapalbhati pranayama. And finally, the real quieting down your mind is your alternate nostril breathing, Anulom Vilom pranayama, and also with your Anulom Vilom pranayama without closing your nostril. So let's show you a little bit, just few asanas, how to massage. But remember, this is the most important asana is your keeping your spine straight. The moment you keep your spine straight, you feel a sense of your relaxation. Squatting pose, Malasana. Malasana is a very effective asana for PCOS, for polycystic ovarian syndrome. Do Malasana. So now In a good malasana, you sit down, put your hand there inside. This also balances your pelvic chakra. Call it a Swadhisthana chakra. Swadhisthana chakra is connected with your reproductive system, which ovaries are part of it. The sound to balance the pelvic chakra, which is connected with the gonads, also connected to your pelvic plexuses, and it is the water element. So the mudra to balance this chakra is your Varun mudra, touching your little finger and the thumb. So sitting in malasana, squatting pose, and chanting the sound called Vam. Vam is a sound to balance your pelvic chakra. Vam. You can keep on doing the Vam, because Vam balances the pelvic chakra. Vam. Seated with the spine straight. Dandasana, opening and separating your toes, also relaxes your feet, relaxes your whole body. Separate your toes, breathe in, breathe out. You can do total. Seated forward bend. So hold onto your toes, keep your spine straight, close your eyes, and slowly go down on your own. Do not bend your knees. And if you feel, always keep the knees straight. Listen to your body's signal, no pain. effortless breathing. If your breathing gets interrupted, wherever you come, you stay here. If not, you can progress. You can slowly come down on your own. Head will come down and head will touch your knee. And able to stay in the pose. You stay here between 5 to 10 breaths effortlessly. Effortlessly means I'm talking, I'm singing. And slowly get up because you're pretty well relaxed. Grinding. Let me show this way. Chakki Chalanasana is a powerful tool to massage the pelvic organs, especially ovaries. Breathe in, and go down. Go to the uplift side. You do it about 5 times on each side. That's good enough. Chakki Chalanasana. You can do a yogic sit-ups. Yogic sit-ups is a little tricky. First, you could get a simple sit-ups, like the hand here. Get down, get up. Always do the breathing, like remember, before a muscle works, you have to breathe in, breathe out. Now comes the yogic sit-ups. Let's see if you're doing it with me. If you can try, put your hand, both the hand behind your head, and try to get up. Oh my God. 1, 2. Breathe in, breathe out. Ooh, I love it. Beautiful. Okay. Bakrasana. Your right foot next to left thigh. Knee, left hand goes outside your right knee. Right hand goes to the back. Touches your knee. Breathe in, breathe out. Breathing out, normal, then breathing in. Slowly turn your body. Look all the way as far down you can look. Spinal twist. Opposite side. Wonderful asanas for massaging the pelvic organs. Right arm goes outside your left knee, right hand touching the knee. Slowly turn your body all the way to the back. Bakrasana or a spinal twist. Bhushasana, buffalo pose, the way cows and buffaloes sit. One knee in the top of the other knee. Then you will do a Ardha Matsyendrasana. In English translation is half Lord of the Fish pose, which doesn't mean anything because Matsyendrasana is a famous yogi. This is so relaxing, so comforting. Once you get into this, you really don't want to get out of this pose. In fact, it happens so many times with me. I'm sitting in a chair or I'm listening to a press conference, some presentation, and my feet will go up like this. And also remember, we do the practice with our heart tracker or a health tracker. So I can see what is all the functions, my health parameter. Let me see if I can get a quick EKG on me. Wonderful EKG tracing. 30 seconds EKG. Says sinus rhythm. Heart rate is 67 beats per minute. And cannot be any better health parameter than this. Heart in a normal sinus rhythm with 67 beats per minute when I'm practicing yoga asana. So this is the proof. So we as a physician, we are not making up any outcome of these practices. I'm showing it to you through a health tracker. If you want to practice, many of you have a health tracker now. Apple Watch, Fitbit, then all the Android watches. What is the Samsung's one? Anyone, use it. You'll be amazed how beautiful it is and how powerful it is for your practices. Ardha Matsyendrasana. Right foot goes next to your left knee. Left hand will come outside your right knee. Right hand will go to the back. Left hand comes to the knee, comes to the leg, comes to the ankle, to your feet. Breathe in and out. Slowly turn your body away from you. 5 to 10 breaths is a good practice. So think about any asanas sitting down which will massage your lower abdomen and the pelvic areas, massaging your ovaries. But primary therapy is able to hold into these asanas. Sthiram Sukham Asanam. Stillness. I'm still in this asana. Sukham. I'm happy in this asana. And also staying for a longer time, you go through the phases of the asana. First is called Arambha, beginning. When you begin an asana, the muscle contracts. Muscle and contracts, ligaments tights up, let you get into this posture. But if you stay in the posture for a little long time, then the muscle starts to relax. Before relaxing, it causes little fasciculation. And that's what you say, the sthiti, the stillness. And after fasciculation, stillness comes. Arambho, sthiti, then you get into a profound level of relaxation, the quieting down the limbic system. That is called a Visarjan. Visarjan is surrender. You surrender to your inner being, surrender to the divine, surrendering is all level. You really don't practice yoga. You don't practice any asana. Asana will come to you. Remember, you smoke, you eat all this comfort food, all this fried food, fatty food, all this stuff. What most of even physicians don't understand, these are comfort to calm down your mind. So the underlying cause is a stress. The person is in a stress. And in the state of stress, they're going to smoke, they're going to drink, they're going to eat all the comfort food. So I say, oh, stop smoking, stop drinking, stop eating, French fries, stop eating, this whole burger, stop eating this. It's not going to work because underlying cause is the activation of your limbic system. Here, in the opposite, always remember, these asanas are to balance both sides of your brain. So, go to that. Right arm will go outside your knee, right hand will go into the knee. Slowly you can come to touch your ankle. Turn your body all the way from you. To these few asanas. These few asanas followed by your pranayama practice and the meditative practice be good enough to control your PCOS. Now remember that yoga is very effective for polycystic ovarian syndrome. The reason being there is no good therapy. All the therapies which are based on your using one hormone against the other. Since there's a hormonal imbalance, you can do your blood level, find the level of your estrogen, progesterone level, and also your testosterone level, like androgenic hormones. And then you can use the medication or use the hormonal imbalances. Actually, the initial therapy for irregular menstruation is the birth control pills. These days, even very young women are developing. And you have no idea how many young children are having a level of stress. So from here, so sign of health, as all of you know, able to sit down in squatting pose and able to get up here without any support. We got all settled, all things done. Kapalbhati Pranayama. Kapalbhati Pranayama, there is a balloon here in the abdomen. There's a diaphragm here, there's a balloon here. Bring your awareness to belly button, push the belly button back. It will hit the diaphragm, hit the lung, all the air will come out. In the process, it will massage all the intra-abdominal organs, all the organ inside. It will massage the diaphragm, massage the lung. In fact, it also massages the heart, which is in between your lung. Then you do it to the mudras. There are 10 mudras. Index finger and thumb, Dhanu mudra or Ganu mudra. It is coming, quieting down your mind. Meditation mudra. Index finger down, finger up. This is your Vayu mudra. Quiets down your Vata energy. Vata energy is one of the reasons for your PCOS, because it's the mobility increases your stressful elements. Middle finger and thumb is called your Shunya mudra. It improves your hearing. Ring finger and thumb, Prithvi mudra. It helps your grounding, helps balancing your kapha. The first two mudras, the Dhana mudra or Gana mudra balances your pitta. Vayu mudra balances your vata. This balances your kapha. Varun mudra balances the water content. It balances your bladder, any bladder dysfunction. Skin, because skin is primary, the health of the skin is a vasodilatation. The blood supply to the skin opens up, so it causes better perfusion to your skin. Shakti mudra, ring finger, little finger and thumb, gives you strength. Shakti mudra. Middle finger, ring finger and thumb, this is your Apna mudra. Pachan mudra, digestion mudra. It removes all the excess in your body. All the excess in your body causes all the disease. Put the index finger down, Apna Vayu mudra, or called it Hridaya mudra, improves your heart function, lung function. Lot of mudras are there, or call it Linga mudra. It improves your phlegma and cough. Ganesh mudra, remover of obstacles. Our practice is to do about 50 Kapalbhati Pranayama. Kapalbhati means Kapal is a forehead, Bhati is a shining. So it ignites your Agni, the digestive fire. It ignites your Agni, it improves your Tejas. So it looks like you're glowing. People who practice said, you're glowing around your face. So Kapal is the forehead, but is a shining. Let's say forehead is shining. Let me show you just about maybe, so do 10 Kapalbhati Pranayama in each mudra. So you'll get an idea, but when you practice, and also you practice the pranayama as if it is your normal breathing. And don't push yourself if you have any effort in breathing. Dhyana mudra or Jnana mudra. Also, if you're new to the practice, you can put your hand here. You push it down, you'll see air will come out. One person told me one time, cannot do it. Cannot do it. So I gave you a little nice trick. Can you cough? He coughed. Then I said, why don't you cough with your mouth closed? Becomes Kapalbhati Pranayama. Dhyana mudra, Jnana, Vayu mudra. If you want to do with me, keep doing it. Shunya mudra. It massages all the internal contents. Massages your liver. Massages your stomach. Massages your spleen. Massages your colon. Massages your pancreas. Massages your intestine. Prithvi mudra. For women, massages your uterus. Massages your tubes. Massages your ovaries. For men, it massages your bladder, the prostate gland. For women, also massages your bladder. Varun mudra. It all massages your lung. So all the residual air comes out from your lung. It massages the heart in between your lung. Shakti mudra. So heart gets massaged, heart gets better. Even when heart stops, we do a CPR, called cardiopulmonary resuscitation. We do a chest massage. In a chest massage, basically we are massaging the heart. So massaging the heart from inside, we call it is an internal CPR. Apna mudra. Apna Vayu mudra. Index finger down. It is called Hriday mudra. Heart mudra improves your heart and lung function. Linga mudra. Kapalbhati Pranayama, as I said, is massaging all the internal organs, and it is the primary therapy for polycystic ovarian syndrome. It also follows with your Udyani Bandh breath holding and exhalation, and your Agnisar Kriya. Agnisar, Agni is your fire in the Jaఠaragni, digestive fire. Sara is your essence. I do it. Adhimudra. The technique will be breathe out first. Take a deep breath in, completely breathe out, then suck your stomach in and hold. Breathe out first. Also do this Udyani Bandh with the Jalandhar Bandh, chin lock, then call a Mula Bandh, root lock. Contract your pelvic floor and pull it up. Call a Mahamudra, great lock. Breathe out first. Remember, when you get a cough, you know the air is going into the right track. Air is going into your larynx, then it is the larynx, and don't get any concern when you get a cough during a pranayama practice. Mahamudra, great lock. Agnisar Kriya. Agnisar Kriya. Move your abdominal wall and massage your abdominal contents. Basically, you do the Uddiyani Bandh to lock and massage your abdominal content with your abdominal wall. The abdominal wall is relaxed enough, it will massage your all of your contents. Finally, the quieting down your mind, obviously, is your balancing both sides of your brain, alternate nostril breathing, Anulom Vilom Pranayama, followed by meditation, Anulom Vilom Pranayama, without closing your nostril. Left hand, use a meditation mudra, Dhana mudra. Right hand, close the right nostril. You don't have to close all the way down, just if you put underneath your nostril. Breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril with the ring finger and little finger. Breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril. Breathe out through your left nostril. Left nostril is controlled by your right brain. Right brain is intuitive, right brain is cooling, right brain is female, right brain is parasympathetic. Do the same thing, exhalation longer than inhalation. Right nostril is controlled by your left brain. Left brain is analytical, left brain is hitting, left brain is male, left brain is sympathetic. It balances the right and left brain and balances the sympathetic and parasympathetic tone, and essential outcome is the increase in the parasympathetic tone, because left nostril breathing, the Chandranari, is more dominant than the right nostril breathing, the Pingala Nadi. Slowly bring your index finger and middle finger on your third eye. Close your eyes, bring your awareness to your third eye, and use your left hand, cross your hand like a super brain yoga, hold the earlobe, and then continue the alternate nostril breathing. Continue this until you have any effort. We don't have any efforts to continue. So our practice, generally an hour of practice in the morning, 25 minutes of asanas, 25 minutes pranayama, and 10 minutes of meditation. We do 5 to 10 minutes of Kapalbhati Pranayama, 5 to 10 minutes of Ulom Vilom Pranayama, water nostril breathing, and also the 2 to 3 minutes of your Bhastrika Pranayama. Bhastrika Pranayama is to improve your lung function. To finish with a meditative alternate nostril breathing, which initially looks almost impossible, but with the practice you'll be able to do it. With the practice of yoga, you enter into your subtle body, from gross body to subtle body. When you are in the subtle body, you can visualize without having your gross body or sthula sharira. Like I'm visualizing my subtle body. I'm in the yoga studio in Newport News, Virginia, or in Portsmouth, Virginia. I'm entering into the door. I'm sitting down on my mat. I'm teaching a class there. Same way, quiet down your mind with your dhyana mudra or meditation mudra. Bring your awareness to your nostril. Close your eyes. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through the right nostril. Breathe out through your left nostril. I can clearly visualize I'm breathing through one nostril, breathing out through the other nostril. Close your eyes. In silence, continue this for a few times. At home, you do it a lot longer. So when you access your subtle body, Shukha Sharir, with the eyes closed, you can touch any part of your head. Eyes closed, you touch your head, touch your left shoulder, touch your left index finger. You can touch any part of your body without looking, because this is the body of your memory. You memorize it. Put your hands in a lotus mudra, touch your little finger and thumb, separate your ring finger, middle finger, and index finger. Bring it in front of your heart. This is your Anahata chakra or heart chakra. Just slowly bring it in front of your heart. Heart is the site of your soul. We always talk about memorized by heart. Brain and heart is connected. They function at the same time. What is good for your brain is good for your heart. What is good for your heart, good for your brain. Slowly bring your hand again in front of your heart chakra. Put your hands together. Put your head down. Say namaste. I honor the divinity within you. You are divine. And with this practice, my polycystic ovarian syndromes are all gone. Practice this. If you have any question Any comments, please let me know. I'll be glad to answer for you. And there will be no treatment as effective as this for polycystic ovarian syndrome. What do you call? If you do it, karo yog, raha nirog. Keep doing yoga, you'll be disease free. You convert from a disease called rogi to a nirogi, disease free, then a yogi and yogini. People with a balanced lifestyle. Thank you for joining. I'll see you again in Saturdays when I'm in town. I need to check your schedule if I'm in town in next week or not, but I'll let you know through my Facebook posting. Okay, goodbye.